So, Alan, can you tell me a little bit about how you use Dupilumab now in your clinical practice of patients with severe atopic dermatitis and where that falls in your treatment algorithm for patients?
Sure. In the past, with atopic dermatitis, when patients weren't responsive to topical treatment and cleared relatively quickly, we oftentimes went to phototherapy and or other systemic treatments for which there's not a lot of evidence. So I've used in many patients cyclosporin, mycophenolate, azathioprine, and a whole host of other agents. I do think that it's much easier to use drugs like Dupilumab from the perspective that the amount of systemic monitoring that's required for drugs like cyclosporin is large. We know from a long-term study done in psoriasis patients that essentially all patients treated with cyclosporin over the long term develop renal function impairment. So these other drugs are really problematic when it comes to long-term management. And now we have the safety profile of a drug that is very well characterized and appears, at least to me, to be far safer than drugs such as azathioprine as well as cyclosporin. So I think that when patients are willing to overcome the barrier of doing self-injections, which they can overcome in almost all cases, we have a treatment that we really understand the safety profile for, and I believe is likely much safer than our old-fashioned small molecule treatments. How about you, Lindsay? How's it been for you?
I agree with everything that you've said, Alan. I think the risks of the systemic medications that we have historically used in this patient population is relatively high. And Dupilumab is such a safe medication that I feel much more comfortable using it in my patients with more severe atopic dermatitis. One of the things that I've been so pleased about with Dupilumab is how quickly it works. So my patients with atopic dermatitis tend to have significant reduction in their itch almost immediately after their loading dose. And typically when I see them back after 6 to 8 weeks, they've had several injections, they are substantially improved from where they were prior to initiating Dupilumab. And the reaction of my patients to this medication has been overwhelmingly positive. Has been life-changing for many of my patients that have really struggled with this disease for many years. So it's quite rewarding as a provider to be able to give these patients some significant relief, patients that have more severe disease.
You know, as a result of working with these clinical trials, as well as a whole series of clinical trials of other atopic dermatitis interventions, I've started asking my patients about their itch severity. Certainly, we can do our own global assessment as to their severity, but we don't have a very good way of assessing how severe their itch is. But in the trials that were used to approve Dupilumab for atopic dermatitis, they asked the question about the worst itch severity over the past 24 hours on a 0 to 10 scale. And now I routinely ask this of my patients to help get an insight into how their itch is affecting them. And it's great to see that meaningful itch reduction that is greater than 4 points on this 0 to 10 scale is achieved in a reasonable proportion of the people who take the drug.
Well, Alan, thank you for that comment. I think that really reminds us that we should be asking our patients about the symptoms and the impact of this disease on their daily life. And our appointments with these patients are an opportunity for us to connect with them and to hear what's really been going on with their disease when they've been at home managing it on their own. And I think this also helps with understanding what disease treatments that they are going to want to do, and is an important part of that shared decision making with the patient. So I think getting the patient perspective is critical for that.